and welcome to Meet the Experts. I'm Dori Soukup, and with me today is my very special guest, Dr. Kimberly Vega. She is here today to share with you ageless beauty and wellness secrets. I'm super excited to have her here with me. She's the founder and CEO of Golden Rose Medical Spa in Apopka, Florida. And she is here today to share with you great treatments and the latest innovation in medical aesthetics so she can help you look and feel absolutely amazing. So stay with us because she's going to be sharing all kinds of great information. I am so happy that you are with us here today.
Thank you so much for having me here today.
It's our pleasure.
It's been a long dream being interviewed by you, so I'm so happy, and thank you for the opportunity.
Yes. Well, we have so much to cover.
Yes, we do.
I know you have a lot of great information to share, but I think the first thing we should share with our audience is what made you decide to become a doctor? How did that come about?
Oh my God, where do we start? To kind of tell you a little bit about my background,
Yes.
I am board certified in family medicine, and I did that since 2016. And I realized that I was not happy. The whole traditional medical industry is ruled by insurance.
Yes.
And you know, you don't go to medical school and then you study all these years and then your insurance is telling you what to do.
Yes.
So I didn't like that. And you know, in medicine, it's just a symptom and a medicine. Symptom and medicine. They don't really teach you, you know, how to actually get to the root of the problem.
True.
So that's why I kind of step away from the traditional medicine and got into med spa and aesthetics.
Yeah. Well, that's an interesting transition. So what is it about medical spa that appealed to you, that made you leave the traditional medicine and come into beauty and wellness?
Getting to the root of the problem. I decided that I wanted to go back to school and learn a little bit more about functional medicine. So I did that, got board certified in functional medicine, and when I was doing that, I knew I was missing something, and it was the aesthetic world. So I decided to study a little bit more and get into the aesthetic industry, and I love putting them both together. So it's what I call functional aesthetics.
Yes.
I'm using the functional medicine into aesthetics, and that's how I actually give my patient the best results they can have.
I love that. You have a certain philosophy that other people really don't have. Can you share a little bit more about how that came about?
The functional aesthetics?
Yes.
Well, you know, functional medicine is getting to the root of the problem. What's actually going on in your body that you're experiencing X and Y symptom. And then in aesthetic, we all want to look the best and feel our best. So what is happening in your skin that you're not having the result you're looking for? And that's when I get into what I call my Image Pro skincare consultation, that I deep dive in what's going on in your skin so I can combine skin nutrition with injectables or derma fillers or whatever is, you know, the service they're going to be using.
Right. And that's what I love about your practice is that everything you do sounds like it's customizable and you look at the root of the problem first.
I have to.
Yes. So where does that come from? Like, what do you do once you find out? What kind of treatments do you usually recommend for people, depending on their ages, maybe?
Well, the first thing we do is I like to get to know you.
Yeah.
Like, even if you call and say, hey, I want an appointment for Botox. Okay, that is fine.
Yes.
We can do your Botox appointment, but let's also get to know you. Let's look into your skin. So I have a consultation room in my practice with a technology called Image Pro, which basically takes a lot of pictures of your face, even on 3D, so I can see what's actually going on. I can see your pigmentation problems. I can see how deep are your wrinkles, your sun damage, your inflammation, rosacea, if there is a melasma that's trying to form in your skin. But I can also see your pores and bacteria.
Nice.
And by having all those details, I can customize a treatment for you. Because even if, yes, we do recommend the Botox, what else do I actually need to give you results? Is this a CO2 laser? Is it a customizable skincare product?
For sure. And that varies really depending on the ages of the people. So you have some clients who are 30, 40, 50. So how do you target certain problems by age? What kind of treatments would be ideal for those?
I have patients 14 years old that just come for regular facial because that's all we can do, to my 80-something years old patient.
Wow.
So I have a whole broad spectrum of clients. But I think someone in their 30s, you need to start stimulating collagen, and here's why. At age 25, our bodies stop producing collagen. That's it. It's just how we were
I had
created.
no idea it was
Yes,
at such a young
age 25, we
Wow.
stop.
Okay.
And then at age 30, you start losing 1% of that collagen every single year.
Wow.
So in your 30s is when you need to start to stimulate your own collagen. It doesn't have to be doing all these lasers or stuff like that, but start with something as basic as a traditional microneedling.
Okay.
Because you want to stimulate your own collagen production to slow down the aging process so you don't need a facelift when you're 50.
Yeah. So if someone is not familiar, you hear the buzzword microneedling.
Yes.
So if somebody's watching us today is not familiar with that, what exactly is microneedling and what benefits does it provide?
So there's two types of microneedling. You have your traditional microneedling, which is the little pen with 24 or 12 tips. And then you have your RF microneedling. It's more advanced. It's radio frequency microneedling, and that is more aggressive treatment.
Okay.
But going back to your traditional microneedling, the little pin, we're just kind of creating a injury to your skin, because as a result, your body is going to get all those healing powers and growth factors and put it into your skin to heal, and that healing process create collagen.
Okay.
But this is what makes a difference, when you get some microneedling done. We need to give your skin nutrients. And I think this is the thing that's changing in the industry right now, because before you were just doing a microneedling and that's it.
Yes.
But now we combined microneedling with food nutrition to the fibroblasts, because the fibroblasts are the ones that are in charge to create collagen.
Yeah.
So it's like you're insulting the skin to create collagen, but you're not giving nutrition to the fibroblasts.
Yeah.
So how do you expect your treatment to be efficient if that nutrition wasn't given?
Wasn't there, yeah. So what results can I expect from microneedling?
I love microneedling, honestly, and that's something that I do on me all the time, because my whole life I have struggled with acne. I have what I call hormonal acne. So now it is under control, right? But the scars were there.
Okay.
And microneedling is what has helped me tremendously to improve those scars. So yes, it can be used to improve scars, but it also can be used to reduce the depth of the wrinkle by that collagen stimulation and overall a nice skin resurfacing.
Yeah, well, it's such a popular treatment. You hear about it
Yes.
all the time.
It
Is it
is.
painful?
Honestly, no, but I do have a high pain tolerance, but I know my clients in the practice. So even if you have an appointment at 4, we'll make you come at 3:30 so you can get nice and numb, and then we can do the microneedling.
Yeah, that makes sense.
Yeah.
So microneedling is great, sounds like, for building collagen and tightening the skin
And
get
acne
rid of
scars.
acne scars, which is great. A lot of people suffer from those
Yes.
things. But then one of the most popular treatments in the medical spa are injectables. Everybody
Yes.
wants to run to you and get
Yes.
Botox or whatever other brands of injectables.
Yeah, that's the bread and the butter
Yes.
of owning an aesthetic practice is Botox and fillers. And they're good, they've been, in the industry for over 20 years now,
Yes.
and they do the job. But I think the industry is changing. I think they're going towards more biostimulation, more natural looking results than just the Botox and the filler. We have all seen Lindsay Lohan and how beautiful she looks.
She does.
She lost weight, obviously, but I do think she dissolved all that old filler and she got into biostimulation like
Interesting.
Sculptra and Radiance,
Yes.
and she looks so young and so
Yeah.
beautiful.
So now you're
so
talking about
beautiful.
fillers, in case our audience
Right,
is
right.
not familiar.
So there's two types of fillers.
Yes.
We have your traditional hyaluronic acid fillers,
Yes.
which are to give you volume. Cheeks, chin, jawline, and lips, of course. And then you have your biostimulation fillers, which are not made to give you volume, but rather stimulate collagen and elastin production to get that natural volume back.
Yeah, sounds good. So which is your favorite?
Biostimulation.
Yeah.
Although I love doing lip fillers. Like that makes me so happy because I can give you instant results.
Yes.
With biostimulation, it takes some time to get the results. Take 6 to 8 weeks to start noticing tangible results.
Okay.
But in the long run, I think it's the best thing you can do to slow down aging.
Good. Does it matter how old you are? Which way would be better?
I think it depends on what you're looking for. For example, if I get a client that's coming to me and, she said, hey, doc, I hate my nasolabial folds. That's one of the things that everybody complains about, even if you're 30 or if you're 60. Right? But first we need to understand, why is this happening? Why do I have nasolabial folds? It's because everything is going down instead of going up.
I know, I can tell.
Yeah. So I use a combination of both. I can use my traditional hyaluronic acid fillers to give you that cheek, because if we're lifting the cheeks, automatically my folds get better. So I can lift here laterally. I can do some temple fillers. I can do some jawline fillers, and I'm doing this, right? So the folds get better.
You're basically resculpting the face.
Right, because as we age, we're losing bone, we're losing muscle,
For sure.
and we're losing fat.
Yes.
So I use the traditional fillers, but I also use my biostimulation fillers. Sculptra, for example. I can do Sculptra in my nasolabial folds, and I'm naturally getting that volume without looking too heavy with the regular filler.
I need to come and see you and get some sculpture.
Let's get your face under Image Pro.
Yes, for sure. I need some help. I need all the help you can give me.
I'll do that.
That's for sure. Let's talk a little bit about skin texture. You hear a lot about doing peels or CO2 laser, and take us through the stages, again, by age maybe, of what should be some things that we can do to improve the texture of the skin.
I love CO2 lasers, but I also love chemical peels. If someone is 30, I might not do an aggressive CO2 laser. You don't need it.
Right.
Maybe I can just do a series of glycolic acid peels or salicylic acid peels, and you get your nice, beautiful, amazing results. But someone that's in their 50s and 60s, more of that texture, more wrinkles, then I can be aggressive with a CO2 laser and do a full skin resurfacing. And what I love about cool peel or CO2 laser is results are immediate, almost immediate, because once you heal, you see your results.
How long does it take to heal?
Depends how aggressive we are. For example, if we do a lighter version, which is the cool peel, which we can do every 4 to 6 weeks, couple days, maybe 3 or 4 days, and then you're good and you love your baby nice skin. But if we do an aggressive CO2 laser, which is what I recommend when we have deep scars, deep wrinkles, or for my mature skin, then maybe 2 weeks. I would say, because you will be swollen. I do get a lot of clients, and that's my mom is included, that you have a lot of excess skin on your eyelid. So we can do an aggressive CO2 laser, and that will shrink without having to go the surgery route. And you will be swollen for about 2 weeks.
Okay. Now, can you wear makeup? Can you still get out? Is it going to be like too swelled up?
I have patients that they go out. They don't care about how they look. They just put a mask and keep walking.
That's a good idea now.
Yeah, of course, you can do that even for lip fillers. So with a cold peel, you can put makeup in about 72 hours. In 48 hours, you can put your SPF. That's important. You cannot go outside with any procedure without putting your SPF on. With the aggressive CO2 laser, I would say for at least 2 weeks, I don't want you to put in makeup on your skin. You can put your SPF, your moisturizer, and all that good stuff, but not makeup.
So after 2 weeks, then you can resume to normal
activities. With the traditional aggressive CO2 laser.
Okay. So what type of home care should they have? Like, let's say I did the CO2. What do I need to do at home?
I can be a little biased here because I love Elastic Nectar. It's one of the best post-procedure skincare routine that you can take. But I also like Hydrinity antibacterial spray because it's a spray that will hydrate your skin but kill bacteria.
And you're not rubbing.
Exactly. So I will always customize your procedure, your aftercare, because not everybody is the same. And if you're acne prone, I might not do the nectar. I might just go the Hydrinity route. So it really depends. But for the most part, you will have an antibacterial spray regardless, and then the nectar to heal your skin.
Very nice. That's amazing. So as far as the other home care, I know that this is a big part of, you guys do one thing in the facility in your med spa, But then I feel sometimes when I go get treatments, and if nobody tells me what I need, then I feel lost, because it's a zoo. Like, you don't know what good products are and what are not. So what are some of your favorite home care products to really help me look amazing?
This is an hour-long conversation, honestly.
Sure.
Again, we will customize what you need based on the results that we get from the scanner of your skin. But I think basic, you don't have to have a 10-step routine skincare at home like I do, but we can always keep it simple. But there are some vital ingredients that I think you should have at home.
Okay.
Of course, a good cleanser. We all know that. And a good SPF. But vitamin C as an antioxidant and as a lining agent. Now, if you're acne prone, I don't want you on vitamin C. I want you on niacinamide instead, which is also an antioxidant, but it's not as aggressive as vitamin C is that can make your acne worse.
Interesting. I never knew that.
Yes, that's the thing that not a lot of people know, but it happened to me when I got into aesthetics. I wanted vitamin C because I know how good it is for you as an antioxidant. But I noticed that I was breaking out. And I was like, let me just put more vitamin C on, because what is going on? It's just a purging. And then after that happened, I started reading and educating a little bit more. And acne-prone patients should not be on vitamin C. And some esthetists might differ, but the reality is that it is so harsh for a sensible skin that has acne. So it can break the barrier of the skin, and that bacteria can get deeper and cause more breakouts. So niacinamide for sure. A good moisturizer or hydrator. Some people don't believe in moisturizer, but they do believe in hydrating the skin. So one or the other is okay. And of course, at night, your retinoid. Those are basic ingredients, five steps. That's all you need to have good skincare routine at home. But there's a difference between over-the-counter and medical grade. So medical grade has science. They're backed by science. With over-the-counter, I honestly think it's just a waste of money and waste of time, because you don't hear Hydrinity, you don't hear CO Skin Health advertising their products in TV. You don't see it in Walgreens. You don't see it in Walmart. Because I think they invest their money in creating quality products versus Neutrogena, CeraVe, all those lines that we all know. They invest their money in marketing.
Makes sense, for sure. So. Yeah, you see a lot of commercials with that.
Yes, and that's not good.
Yeah. A lot of people want to invest in their beauty and wellness and all of that. But there are some things that you can do for people to help them look good, no matter at what age. And having a facial is one of them. Do you think people get enough facials?
No.
Or do you think that that's something
I'm
that
guilty.
should be?
I don't. I'm being honest. I really don't make the time to pamper myself as a business owner. Just too much to do. But I think a good facial is extremely important for anybody, because we can customize a facial. If you have a lot of wrinkles, let me do a more aggressive facials and maybe use some retinol on top of that. If you have dehydrated skin, let me do a hydrofacial. Like, I can customize the facial on what you actually need. So
I love hydrofacial.
Me too.
Like, I need to have that once a month.
Once a month, at least as a minimum once a month. It doesn't matter your age. If you're 30, if you're 70, you still need to hydrate your skin. And with the hydrofacial, we can infuse deeper some serums, which makes it better.
For sure. What I love about the hydrofacials is when you're done, your skin is literally glowing.
It's glowing.
Like, it's
I love it.
It's unbelievable. Like, when you put your makeup on, your makeup is just...
One of the things that we do your before picture on the Image Pro. We see how dehydrated and how clogged your pores are. We do your hydrofacial, and then we take you back to take a picture. So you can see, oh my God, I needed this hydrofacial.
Yeah, for sure. So what other things do you recommend for people? Especially, we live in Florida. The sun is always beating on our skin. Though you tell people all the time to wear
SPF?
SPF.
100%.
And, some people do, some people don't. What other treatments can they do to really help protect their skin?
Definitely SPF. Like if you're even gonna do lasers or you're gonna do microneedling and you don't protect your skin from the sun, please don't do it. Like the sun is gonna damage, it's gonna make your melanin production even worse. It's gonna make your wrinkles worse.
Yeah.
So we do need SPF. Now for sun damage, there is a really good treatment called Lucente. Not a lot of people know about this.
No,
it's not
I
well
don't know
known.
about it.
I love it. It's Italian, and it was actually introduced in 2024, early 2024 last year, and it is amazing for pigmentation. It is amazing for melasma. There's nothing as good as Lucente for melasma. It has a specific serum that it is, using a lot of different serums on one, and we microneedle that serum. And we use different depth on the needle that when I can put that serum in different layers of the skin. And once you finish your treatment, could be 4 treatments, 5 treatments, and you see your picture, it's like day and night. Melasma is gone. Sun damage is gone.
Wow.
There's really nothing like that in the industry. Even with the big names of lasers, there's nothing as powerful as Lucente as of right now.
Yeah, because I notice, like, as I'm out and about with my friends, and so many of them do suffer from hyperpigmentation.
We're
so
in
I'm
Florida.
definitely gonna tell them about that
Lucente
treatment.
is really amazing, but there's some other things that you can do at home besides your SPF. Niacinamide is known to help with pigmentation. Tranexamic acid and cohoic acid, those are serums that you can use at home to help line in that pigmentation as well.
Yeah, so if you combine all these different treatments, and I think that's where people sometimes don't pay attention or don't take advantage of, is they think they want to come in, just get their Botox and leave, when there's so much more that you can truly help. And that's what I love about your place, is that you take the time to really customize a whole plan for them that will combine different programs to help them.
Some people think Botox is going to magically erase the wrinkles.
Everything.
It's not true.
It's the answer to everything.
Oh, it's not. I mean, we love it. I get it twice a year myself. I love it. But,
it's not the answer to everything. It's not.
And I don't think a lot of people know that once you have static line or lines that you see on your skin with no movement on the muscle, like Botox is not going to do much. You have to do skin resurfacing to help those lines that are already indented on the skin.
So, I love the fact that you focus on corrective care.
Yes.
But also I know that you believe in preventative care.
Yes.
So when do you think someone should really start investing in their treatments, in their skincare products, all these things?
I would say in your 20s, honestly, especially after 25, because you just stop producing collagen. Now, if you can't at 25, then at least minimum 30, because that's when you start losing 1% every single year. Something as simple as a microneedling can make a difference when you're 50 if you started when you're 30. You might not need Botox. You might not need a facelift, So definitely start early.
Very nice. Yeah, it's important. So I know that you're huge into wellness too, and especially coming from the medical, the functional medicine. I know you're about to publish your book on wellness.
That's correct.
Super excited for you.
Me too.
We're going to put a thing about it at the end of this video so people can go and get it.
Yes.
So let's talk about that. Obesity, overweight is one of the biggest problems I think we're faced with in the U.S. Even children are suffering from obesity and being overweight. So
this is
where
a
do
subject,
you go?
Honestly, we can be here until tomorrow because there's just so much to talk about it. I actually lost 51 pounds myself.
Wow.
My highest was 235 in 2020.
Wow.
And I lost 51 pounds.
Congratulations.
Thank you. It wasn't easy. It took me about 9 months, and it took me understanding what was happening in my body. I'm very sensitive to carbohydrates and sugar. If I go out with my husband, have dinner, and I'll eat a pasta, I'm like 3 pounds heavy the next day. I'm very sensitive. And I understood that for me to lose the weight, I needed to stay away from as much carbs and sugar as possible. But here's the thing. Carbs and sugars are everywhere. Even on cereal,
Yeah.
even in breakfast. So we're feeding unhealthy things to our child. And that's why the obesity in children's is like, I think it's like 70 something percent at this point. It's crazy. We need to change the mentality of everybody and start nourishing our kids at home for sure.
No, I totally agree. And especially like when you go out to a restaurant and how much food they give you. It's like, why? Why are you giving them so much food? So that doesn't help either.
No, and I think this is the thing, if we want to go a little bit more deeper into how the body works, when you give your body carbohydrates and sugar, your body's going to ask you for more and more and more.
It gets addicted.
Yes, and it's going to produce more leptin. So leptin is the hormone that makes you hungry. So that hormone is being fed by carbs and sugar. So if I eat a pizza, I want another slide for sure. Versus if I eat a nice salad with my fish and my broccoli and my avocado, I'm satisfied.
Yeah.
And I can be 4 hours without eating because I'm not hungry. But that doesn't happen with a pizza.
Right.
Or a piece of cake.
Right.
I want more.
You just want more and more, yeah.
And that's addictive, and it's a cycle. It is a cycle that we need to break in order to be successful and be healthy and lose weight and balance our hormones.
So what program do you offer for losing weight? Let's talk about weight loss first.
Okay, so I am a firm believer on resetting your metabolism because nowadays everybody wants to be on these injectables, on these GLP-1 medications, but they're just a tool. Like if you don't get to the root of the problem, what is happening in my body, that my insulin is high, that I'm borderline diabetic, that I have high blood pressure, high cholesterol. If I don't fit that, it doesn't matter how much Ozempic I give you.
Yes.
You're not going to be able to lose weight. And if you do, once you stop, you will
You're gonna
gain
it back.
because we didn't get to the root of the problem. So I have what I call a metabolic reset weight loss program. So we dig deeper. We do a bunch of blood work. If you go to Quest and LabCorp, they're gonna take like 6-7 tubes out of you. So be hydrated when you get the blood work done. Because I look at vitamins, I look at minerals, I look at inflammation markers, I look at your insulin and your cortisol and the full hormonal panel.
Wow.
I need to have a full picture of what's going on with you in order to customize your program that will assure you you will lose weight and not gain it back.
So do you use medical weight loss?
We do.
Yeah.
We do use injectables when needed. I mean, not everybody needs to be on Ozempic or on a GLP-1 medication.
Right.
Sometimes we just need to give you more vitamin B12 because yours was 200 when we need to have it in 1,000, right? So you might be lacking on vitamin B12. You might have a lot of cortisol, you know, the stress hormones, which makes us gain weight.
Yeah.
So if we decrease cortisol with something as basic as taking ashwagandha, you can lose the weight and not have to be on a GLP-1. But yes, we do use it quite often in the office.
Yeah. And sometimes people feel that they need to eat to gain energy, and here they are getting bigger and bigger, but they're not really getting more energy. How does one get more energy?
Oh my God. I can answer this question in different ways. But this whole mentality that you have to eat all the time to speed up your metabolism is actually incorrect. And if that was true, why is the obesity rate so high if we're eating every 2 or 3 hours like we're being told since the 1970s, right? You can't be eating all the time, because if you eat all the time, your insulin level is going to be high. So to understand what insulin is, right, it is the hormone that our body produces that if it's high, you won't be able to lose the weight. Your body can access fat to burn it for energy. So if your insulin is high, you're going to be storing fat all the time. If your insulin is low, you're going to be burning fat for energy. So we have to normalize our insulin levels in order to lose the weight. But if we're eating all the time, your insulin is doing this all the time. It's always high, and it can never go down until you go to bed. So when you go to bed, your insulin is normalizing because you're not eating. But then you wake up in the morning, and the first thing you do is a donut. Your insulin's gonna, go sky high,
crazy,
and you won't be able to lose the weight.
Yeah.
So we need to kind of give our body the time to use the fat that is stored for energy.
Yeah. So for the past almost 30 years, I only eat one meal a day.
OMAD, that's what we call
And
it.
yeah, so I go all day without eating.
I'm fasting as we speak.
And I just eat dinner. So I get up in the morning, I have a whole milk cappuccino. So that's usually my breakfast. And during the day, I just don't stop. I come to work and I just keep going. And I've been on that diet for many years. And
It's a lifestyle.
I feel great. Like it was, I should have come up with that program.
You should have. Intermittent
Because
fasting
now,
is amazing.
exactly, now it's, you know, now it has a name. I didn't know it had a name.
It does has a name. Even myself, when I was a child back home in Puerto Rico, we had that mentality that you have to eat good in the morning. Like your biggest meal has to be in the morning. So I was waking up, but I wasn't eating healthy. Like I was eating maybe a sandwich with a full juice of orange juice. Like I wasn't feeding my body properly, so of course you won't be able to lose the weight. I love intermittent fasting and what it does, not just for weight loss, but for longevity. And there is research, there's study about how intermittent fasting creates autophagy. So it kind of eats all those bad cells that are trying to become cancerous. So it is a very powerful tool.
Nice to hear, because everybody tells me, how can you go all day without eating? It's not healthy.
Actually,
and,
it is
and you
healthy.
know what? I have more energy. I'm in my 60s, and I have more energy than some of my team members who are in their 30s.
Yes, I am a firm
And they
believer.
eat all day.
I had never been a fan of eating breakfast very early in the morning, because if you think about the word breakfast mean breaking your fast, but you can break your fast at any time.
I never thought about that.
Breakfast, breaking your fast. You can break your fast at 1 o'clock, and it's still your breakfast, and that doesn't mean it's wrong.
I just think people just eat to eat.
I think so too.
Like so many, like seriously, I have team members, that's all they do is eat all day long. It drives me crazy, actually.
Yeah, no, you shouldn't be eating all day long. Or if you're gonna eat, just eat your 3 meals a day. Don't be snacking all the time.
Exactly.
Like that's way too much for your body. And then you ask yourself, why am I obese? Why can't I lose weight?
Yeah, it is. It's crazy.
Yeah.
Let's shift a little bit to hormones. So
Okay.
as you get to be my age, so going through menopause and all that, and then you have this not so good balanced being, and you're disconnected from your loved one, and you have no desire for being connected.
If you think about the divorce rate, it is higher when females become menopausal.
Yes, I believe that.
Oh, it is. There's data.
There's
really
about
statistics
that.
about
I never
that.
thought about that.
Yeah, and if you think about it, what is going on in the female body when they reach 50 or 55? Our hormones decline tremendously. So your whole life, your hormones are balanced. And then start perimenopause, your hormones start doing crazy stuff, because they do crazy stuff. And then once your menstrual cycle stops for a year, you're automatically in menopause. What happens? Your estrogen comes down, which is a really important hormone, not just for sex drive, but it protects your bone for osteoporosis. There is data that lack of estrogen equals higher risk of Alzheimer's. There's a research about that it was done in Europe, and there's a book about it. It's called The Menopause Brain.
Okay.
And it talks about lack of estradiol, estrogen, and the risk for Alzheimer's. But also lack of estrogen causes atherosclerosis or heart disease, obesity, insulin resistant, I mean, you name it, and low libido. And then your progesterone goes down, and then you can't sleep.
Yeah.
You have hot flashes.
That's my big problem.
The
Can't
hot
sleep.
flashes.
No.
This-
I'm past the hot flashes.
You
thank
need some
God.
progesterone,
Yes. So I wake up at 3, 4 o'clock in the morning.
and you're ready to go.
I'm ready to go.
Yeah.
Like I get up and work.
Yeah, not everybody can do that.
No.
But progesterone does help to regulate your sleep. It helps regulate your body, put it to sleep. But there is data that it helps with depression and anxiety as well. And then comes testosterone, which is the hormone that does help you increase your libido. All that comes down when you become menopausal. And then you're not happy, you can leave, you feel like, I don't belong in this body anymore.
Yeah, you're cranky.
You're cranky, you think you're going crazy, you're having brain fog, you're forgetful, and then you're like, what's going on?
Yeah.
And it's a lack of hormones.
Yeah.
Hormones are not bad for you. And that is a misconception that we all have, because back in early 2000, there was a study that said that hormones are bad.
Right.
But what they actually didn't explain, it is that synthetic hormones are obviously not good for you. And then you have your bioidentical hormones that your body needs to thrive and be happy.
Right.
I mean, I can tell you stories of patients that, go to my practice having no libido, no energy, no will to live.
Yeah.
And then we get them on a customized hormone programs, and then they're having a red lipstick all of a sudden. They're using high heels now. Their hair is done. They're happy. Like, you can see the changes.
Big shift.
It's beautiful, and that's what I do. Is to see people become happier.
You just gave me goosebumps, because there are so many people in what you just described, and some of them have no idea where to turn to.
It really makes me very upset, honestly, Dori, when you go to your primary care with all the symptoms, and then you say, that's just part of old age. That's just part of being a woman. Deal with it. Get over with.
Yeah.
That's not giving our women quality of care.
Yeah, and that's one thing I think gynecologists are not offering hardly ever. Like, you go to the gynecologist, they don't want to deal anything with bioidentical hormones.
No, and the reality is that they don't know how to.
Yeah.
So I honestly don't blame them. I just think the system as a whole, they don't teach you how to properly address a menopausal woman.
Interesting.
They teach you how to give birth controls.
Yeah.
They teach you the fertile years of a woman. But I think you have like 3 hours maybe of menopausal care in medical school or nurse practitioner school or PA school. They don't really teach you how to deal with it. So you have to go out and go and take courses yourself.
Yeah. Yeah, well, that's so great. So what would be the steps for somebody to get started with? Let's say I want to get on this program. What's the process?
The first thing they need to do is contact the office and schedule a get to know you. Because on that get to know you, I'm going to give you documents for you to complete. And I'm going to ask you so many questions about your health, and that's going to let me know what's actually going on. Once we sit down and have a conversation, I'm going to send you for blood work. And I always tell my new patients, come fasting to your appointment, because we can do the blood work in-house.
Oh, nice.
Send
That's
that out.
convenient.
It is convenient. So we do it in-house, and then in 48 hours, I have the results in my office. And then we can dig deeper and get you on a custom treatment plan that is going to work for you.
That's nice. So what is the treatment like? What is bioidentical hormones? Is
So
it a pill?
bioidentical, there's different ways to do it.
Okay.
You can do tablets, capsules, you can do patch, you can do injections, you can do creams, you can do pellets, which people love pellets.
Yeah.
I'm not a fan of those, but some patients do love pellets. I like the oral or the injections or the cream or the patch because I have control over those.
see.
If you have, God forbid, a side effect, then I can say, okay, stop, or let's lower the dose, or let's do this.
Exactly.
When it
You
is a
can
pellet,
adjust.
I can adjust.
Right. It's
You know,
already in the body.
I can do much, which is why not having that control, I can deal with that.
Well, that's very smart.
Yes.
Yeah. I've never heard of the patch. Is it just like the cigarette patch?
Yeah, it's a transdermal patch. It comes in different milligrams depending on what your body needs. It comes either once a week, every day, twice a week, depending on what the
you
patient
keep
needs.
it on the whole time, or is
You
it
keep
just
it on. Let's say that we're doing it twice a week. So let's say you do it on a Sunday, then you take it off on a Wednesday and put your new one.
Okay.
And then change it again on Sunday.
Very nice.
So-
And does it have to be in different parts of the body, or can you use it in the same spot?
As long as it's not on hair, then I'm okay. So
Okay.
if you have hairy legs, don't put it in there.
Yeah.
You know, it has to be in touch with the skin.
Right. Is there a difference between, like, why should I choose a patch over a cream?
I think it's convenience, honestly, because some patients just don't want to be putting a cream every single day.
Okay.
They just prefer to put a patch,
Or
forget
they
about
forget
it.
about it. Yeah.
Exactly.
Yeah, sometimes you may not remember the creams.
Exactly. However, when you have vaginal dryness or when you have what we call painful sexual intercourse, then I like to do at least estradiol intravaginally.
Okay.
That way we get all
Is
those
that a
symptoms
cream?
better. It is a cream.
Are there any
And
side
then-
effects of that?
Honestly, no. It can actually prevent, and this might sounds a little crazy, but it can might actually prevent you dying from sepsis due to a UTI, urinary tract infection. So we know that as we age, females tend to have more UTIs over and over, and they keep giving you antibiotics. If they would just give you estradiol, you will have no symptoms like that, and you'll be a happy person.
Nice.
So estradiol can help prevent the UTIs, and I hope I save someone by saying this.
Yes.
Get into estradiol if you're having frequent UTIs.
Yeah, very nice. Once somebody starts bioidentical hormones, do they need to stay on them for or is this something that you try?
We can customize it.
Okay.
But if you're getting the benefits of it and you're doing perfectly fine, why stop?
Right.
Because once you stop, you're gonna go back to square one. You're gonna have those symptoms all over again.
Yeah.
But what I do care most about the hormones is the prevention that you're getting with them.
Yes.
I'm preventing Alzheimer's, and I'm preventing that I just fall and
Break your hip or
break my
something.
hip, which
Yeah.
the mortality is very
Yeah.
high on that.
I just had a bone density test, and it's scary actually to know that you could
It's
be
a
on you could be on especially as you age, that you could have serious
you have osteoporosis,
Osteoporosis.
which can be prevented
Yeah.
by taking estradiol.
yeah.
Very easy. It's even more effective than the medication they give you for osteoporosis.
How do you feel about supplements? Do you combine
I
this
love
with
supplements. I definitely love supplements. I love magnesium. There's like 4 types of different magnesiums, but magnesium as a whole is such a vital mineral that your body needs. Constipation gets better with magnesium. So if you're on GLP-1 medications, having constipation is a side effect of it. But if you take magnesium, it gets better. It helps you also sleep as
Yes.
well.
I need to start taking
You need
magnesium.
to. Everybody should be on magnesium,
Yeah.
regardless of your age.
Which one is your favorite? Like you said, there's different
oxide.
ones.
I do like magnesium oxide for the constipation part, and because I have a lot of clients on GLP-1s, I say just go with the magnesium oxide.
What about if they're not?
Then magnesium citrate or even the glycinate. Those are perfectly fine. I am a firm believer of vitamin D.
Okay.
Extremely important, not just for the bone. People think it's just for the bones, but it helps your immune system to make it stronger. So everybody should be on magnesium and vitamin D. Those are my vital supplements.
Yeah.
But if you take Botox, you need to be on zinc. There's actually an experiment that was done that if you do take zinc, it helps for your Botox to last longer.
Really?
So everybody
That's
should be on
interesting.
zinc.
So zinc, magnesium, and
vitamin D.
And vitamin D.
Yes.
Those are your secrets.
Those
right
are my
there.
go-to for
Yeah.
supplementation. But of course, if you have some other things going on, then we customize the supplement. But those 3 are my go-to.
Yeah, very good. Wow, you just gave me so many great solutions to how
Go get
how to-
supplements.
yeah, how to become better for sure. So if somebody, you have such great wellness programs. So you have your weight management, you have your hormones, and then what else? What else can I do in the
You
wellness?
can do a lot of things. We do offer IV nutrition,
Okay.
which gives you hydration. But if you're lacking on, let's say, vitamin B12, glutathione, that we can give that to you. If you have iron deficiency anemia, which a lot of females do, then I can replace with iron
Nice.
as well. There's an IV for just about everything.
So you're talking about me coming in, you're putting an IV in
Correct.
me.
We do an IB. We talk about
Okay.
what are your symptoms, what do you have, and what IBs do I have to offer you.
Right.
In my weight loss program, I do have a specific IB. We call it the skinny drip, but it is just some enzymes that we use to kind of accelerate that fat loss.
Oh, nice.
So everybody on my weight loss treatment program, once a month they get their skinny
Nice.
IB drip. But if you have migraines, then there is an IB that can help you with migraine. Instead of going to the ER, pay that huge copayment and then that bill will get to you. There's an IB that is the exact same thing they do on the ear and more for a fraction of the cost.
Very nice. And, you know, the one thing that most people like about the IV is once they go drinking and they want to cleanse or detox.
We do have that.
That's what you hear about a lot.
I have
the
a
hangover.
I call it a hangover IV.
Yeah.
That was actually very popular during the holidays, and believe it or not, on the 4th of July weekend. People go celebrating the independence,
Too
and
much.
then too much. Then they come to the office. They always call, "Are you open? Like I need an IV." Sure.
Yeah. Talking about alcohol, you know, the American society, they love to party and drink. Like when you get together with friends, that's what you're doing, is you're drinking.
Yeah.
So let's say somebody has the weight loss program, they do the bioidentical hormones, but then they're drinking. Is there something that goes on in the body that...
Yes. There's actually something very interesting happening with the GLP-1 medication. Now, I don't know how much the population knows about this, but GLP-1s are actually being studied for alcoholism and drug abuse because there are a lot of patients that take this medication for, you know, diabetes or whatever it is, and they don't want to drink anymore. I have patients in my practice telling me I don't have the urge of drinking wine anymore.
Interesting.
And I have one patient, I'm not going to say her name, but she was addicted to heroin. And she's sober obviously now, and she lost all the weight on the GLP-1, and she told me, please don't take me off of it because she don't have the urge of drugs anymore.
Nice.
So we keep her on a very low dose. We microdose on the medication about once or twice a month.
That's very nice.
Yeah. It's helping a lot of these patients with polycystic ovary disease that can get pregnant. I actually have what I call Ozempic babies in my practice of patients that are able to lose the weight, decrease inflammation, and start ovulating again. And by doing that, they can get pregnant.
Very nice.
It's very nice.
Yeah. How does alcohol affect people? Like, what's the bad thing about alcohol?
It's just affect your central nervous system, which basically direct what you do and who you are. And in menopause, alcohol can disrupt your hormones. And I always tell my patients, if they're postmenopausal on their hormones, if you're gonna go out for a drink, just, you know, be prepared to pay for it. You might not be able to sleep. Your hot flashes may be worse that night. Like, is it really worth it to have those cup of wine and alcohol and then not be able to be happy for a few days?
Yeah. And you know what I love now? All these mocktails are so amazing. Like, they're putting them now on almost every restaurant has the mocktails menu. And I'm really hooked on them now. It's like I don't even want a drink. I want a mocktail.
Yes, I think that's a better option.
Yeah.
Honestly. And even, you know, if you want to go out and have maybe a glass of wine, I don't think it makes such a huge of a difference.
Right.
It's when it's 4 glasses.
It's
5 glasses.
in moderation. I think that's the thing.
Right.
And
It's
that's
in
where a lot of
moderation.
people, I think, go wrong is they can't control themselves. They just want to, you know, drink,
You know,
and eat.
that's the beauty of these GLP-1 meds. They're not just helping to lose weight. They're helping to treat alcoholism, which for me is insane how many benefits this type of meds are bringing into medicine.
Nice. I love it. So how often should someone get IV drips?
Depends on what we're treating. If it's just for wellness, once a month is perfectly fine. I get them like once every 3 months, depending on how I feel. Something that's very interesting on IVs, I get an IV drip to help my immune system before I go on vacation. Like me and my husband, we went to Tokyo and we were there for about 2.5 weeks, right? On a plane for 16 hours and then on a cruise with a lot of people. Me and my husband did not get sick.
Nice.
We both got an IV treatment done with high dose vitamin C and zinc. We were not sick. But there were people in the cruise that were sick. And I was suspecting I was going to get sick. I didn't.
Nice. You built up your immune system.
I truly believe that IV therapists do something to help you with that.
Nice.
But if you have iron deficiency anemia, maybe once a month also a good idea. So it's really customizable on what you really need.
Yeah. So I'm going to Japan, different parts in June.
Yay!
I'm
Get an IB.
Meeting my son there, yeah. Looking forward to it. But it's fun. It's important. How often do you think somebody should detox?
Oh my God. Depending on what you're doing. If you're doing carbs and sugar, get a detox. If you're doing alcohol, please get a detox for sure. So I would say maybe twice a year is a good starting point.
Like a whole cleanse?
Yes, I think it's a good starting point. And there's so many type of detox, just not IB.
Right.
But we also have colon detox as well.
Nice. Well, good.
Yeah.
What other wellness tips do you have?
Oh my God. Exercising is really important.
Yeah, it is
Please.
important.
Especially if we're actually trying to lose weight, the best type of exercise that you can do is on a fasted state. Here's why. If you wake up in the morning and you go out for a workout, you're actually using the fat that you have stored for energy.
Okay.
It's what we call a fasted workout. Another thing is we need to lift weights. We have to build muscle, and we all think that you have to do cardio. Go to run for 3 hours. Go to the treadmill for 3 hours. That's not doing anything. You need to build muscle. It's more efficient, and it actually helps you lose weight faster.
Yeah. So I have a personal trainer because I'm terrible about going on my own. So I go and I see him twice a week, and that's really the only way I can make a commitment to.
At least you're making a commitment.
Stick with it, right?
Yes.
Because you pay them all that money, you better go.
You better go.
So every Tuesday morning and Friday morning at 7 o'clock, I'm there.
I think you're going. Some people don't even go.
Yeah.
And even if you don't have the funds to pay for a personal training, then get some weighted vests and go for a while with a weighted vest.
Exactly.
Or just buy a $5 dumbbells and go for a while with the dumbbells.
Yes.
There's just so many different things to do this.
Exactly. Yeah. So this has been just
I love this.
so unbelievable. You have helped me a lot, and I'm sure our audience has benefited quite a bit from this.
I hope so too.
So for people to come and see you, let's say they mention this video, what kind of special do they have?
I think you need to just call and say, I saw your video with Dori, and I would like to take advantage of my get to know you consultation. And we're also giving a $50 gift card that you can use towards your consultation or towards your treatment as well.
Wonderful, wonderful. Well, I loved having you here, and
this has been great. I love
so
it.
Excited that you are making such a difference in people's lives in Apopka in the Orlando area.
That's why I wake up every morning.
That's
looking forward to
I
that.
can tell you're just so passionate about it, and you're always helping people, and that's what being, a doctor and what you've built there. Your place is amazing.
Thank you.
I'm so looking forward to your book being out because I think that would be a great thing.
Yes.
And I know you have more books in you that you're going to be writing.
Yes. I write a lot. I do a lot of blog posts for the website, and I love to sit down and just write.
Yeah, and you're starting a podcast.
I am starting a podcast.
I love it.
Yes, we're going to start filming at the end of this month, so we're going to share that in social media pretty soon.
Nice. Well, congratulations
Thank
on
you.
all your innovative programs, you being passionate about this, you helping your community. We need more people like you, Dr. Vega.
I think more providers should definitely change their mentality and go into more wellness and functional medicine because we can help with the obesity crisis for sure.
Yes. Well, all the way around. You help them be healthy and look beautiful, which is the whole
thing is from head to toe.
Yes. And everybody, I mean, when you look in the mirror and you see yourself and you like what you see, the mindset all changes.
100%. The way I see my patients entering one way and then leaving another way, it's just amazing seeing the changes, not just physically, but in their emotions. They are just a better person overall for everybody.
Yeah. Well, you're taking them through a whole transformation.
Yes, we are.
Like, you're just really changing them. The way they see themselves, the way they feel about themselves, the way how they mix with others.
Exactly.
And that's what I love about it. I mean, I went and saw some of your reviews and what people are saying and the transformations that you do and the great team that you have. you have built such a great place for
Yes.
people to come and really
Yes.
benefit from this.
I'm very lucky to have the team that I have because they help make Golden Rules what it is today.
Yeah, it's wonderful. Well, you have built a great thing for everyone. Thank you
you.
so much. So I encourage you to go see Dr. Vega. You need to go to goldenrosemetspa.com and go take advantage of the $50 gift card that she is offering you and the consultation, the get to know you consultation, so she can help you look your best and feel your best. So thank you so much for joining us. Thank you for being with us,
Of
Dr.
course,
Vega.
thank you.
And be well and stay healthy. Take care.